Let's meet our kidneys. Our kidneys play a very vital role in maintaining homeostasis in our body and keep us stay healthy. It has four basic functions. It regulates water, remove waste products like creatinine and urea, balance minerals and electrolytes like potassium, and finally, produce hormones needed by the body. There would be instances that this hardworking organ becomes damaged, maybe due to our diet, medication overdose, diseases like diabetes and hypertension, or maybe injury at some point. Once our kidneys are damaged, the waste products accumulates in the body and compromises our health. In order to maintain the balance in our body, people with damaged kidneys seek for help. And as treatment is dialysis. Usually, it will be 4 hours and 3 times per week. The procedure starts by introducing a needle to a fistula or utilization of a special tube called catheter. Blood is then extracted with the use of hemodialysis machine. It then passes through a special membrane called dialyzer that acts as an artificial kidney. This allows the movement of electrolytes and waste products against a dialysate, which is made out of pure water and electrolytes like salt. The clean blood and balanced electrolytes is then returned to the patient, and this cycle is repeated for 4 hours as prescribed. Over the years, the whole Sultanate has a significant increase in the number of patients in need of hemodialysis. Despite the new multiple dialysis centers that has been established in the regions of the country, the healthcare system is still trying its best to keep up with the demand. The center alone listed 51 patients in 2019. It followed by a steep rise of number of 135 and 145 patients in years 2020 and 2021. Exponentially, in year 2022, it is predicted to receive another 165 patients. Statistically, the center dialyzes around 180 patients a day. And in order to maintain the quality of hemodialysis rendered to these patients, the center started implementing monitoring KT/V, or also known as online clearance monitoring.
In Bosher Dialysis Center, we are talking about the quality of dialysis given to our patients. In Bosher Dialysis Center, we are trying to improve the quality of dialysis which has been given to the patients. Recently, we have introduced the KT/V. What is KT/V? KT/V is most widely used dialysis parameter to assess the dialysis dose. What is KT/V? It is a measurement of the efficacy of hemodialysis session. It identifies the effective removal of specific solute resulting from a given treatment in a given patient. It also compares the amount of fluid that passes through the dialyzer with the total amount of fluid in the patient. It is more accurate than urea reduction rate in measuring the amount of urea removed during dialysis. It should be noted that high KT/V is not associated with better patient outcome in clinical trials. Thank you very much.
Assalamu alaikum. My name is Dr. Fadi. I'm a specialist nephrologist in Bosher Hemodialysis Unit. Today I would like to speak about our important project this year for improving the hemodialysis adequacy for patients having end-stage kidney disease. Of course, end-stage kidney disease has many complications and carries a high incidence of morbidity and mortality. That's why we are now focusing on improving the quality of hemodialysis for our patients. Improving the quality of hemodialysis in our patients improve their survival, improve the quality of life and their work productivity, and also have many good implications for their psychological health and well-being. To assess the adequacy of hemodialysis, there are many clinical parameters such as assessing volume overload and also laboratory parameters such as hemoglobin, assessment of anemia, assessment of calcium and phosphorus and parathyroid gland status. However, the most important and the most objective method to assess the hemodialysis adequacy is via the urea kinetic modeling assessment. That's to say, it is the urea reduction ratio and what's called KT over V formula. The urea reduction ratio depends on assessment of the urea level before and after hemodialysis, and by a special equation we can assess the hemodialysis adequacy based on urea clearance. More important than this and more accurate than this is the KT over V formula. The KT over V formula is a worldwide used formula. K stands for clearance, which is the clearance mainly of the dialyzer used in hemodialysis machine. T stands for time, which is the time during hemodialysis session, and divided by V, which is the volume of distribution of urea, which goes really with the volume of distribution of water. Internationally, according to KDIGO guidelines, which is the Kidney Disease Improving Global Outcome guidelines, which is worldwide used, it is recommended that KT over V should be at least 1.2. It is a factor ratio. So the target is 1.2 and better to be 1.4. So at least we should achieve a target of 1.2, and it is recommended to achieve a 1.4, and that's really our best target. So we are monitoring KT over V on monthly basis for all patients based on blood sampling, and by a special equation we can assess this equation, and on follow-up we can improve the dialysis prescription to get a better KT over V and a better dialysis quality. Moreover, now, due to the advances of the hemodialysis machines, we can even measure the KT over V every session, not once monthly as before, by what's called online clearance monitoring. We can measure the KT over V by the use of a special program in the dialysis machine to measure the KT over V every session for the patients. This is very nice because it can guide us to improve or to modify the dialysis prescription session by session for the patients. So finally we can achieve the best hemodialysis prescription for the patient to get the KT over V according to our targets and according to the internationally agreed upon targets, which is 1.2 or better 1.4. So now we can measure the KT over V every session, and this in fact is a plan of our quality group to monitor the patient's KT over V session by session to get the best KT over V we can get. We can modify the hemodialysis prescription, for example, increasing the time, using a better dialyzer to get a best outcome through the KT over V formula. So I wish that we can apply all this for all patients, and now we are informing patients and we're giving health education to the patients to be acquainted with this fact, so that they are fulfilling the full 4 hours of hemodialysis and not skipping any hemodialysis session to achieve a good time and a good clearance by using the appropriate hemodialysis filter or hemodialyzer to get the 1.2 or 1.4 KT over V target. This, of course, inshallah, will make the survival better, the quality of life better for the patient, and for sure all the complications of chronic kidney disease such as anemia, bone disease, cardiovascular disease, infections, and everything will be less than before. Finally, I wish the best health and the best quality of life for all our patients, and thank you very much.
Prior to the application of lean management, the conventional way of measuring KT over V is via blood investigation. The whole process starts from the patient's arrival in the parking lot as they attend on their dialysis treatment schedule. A blood collection is done prior to the commencement of their treatment session. This sample is then called pre-urea. Consequently, they undergo a 4-hour-long process of removal of toxins called hemodialysis. At the end of the session, another blood investigation is collected. It is then called post-dialysis urea. Both samples cost at around 10 reals for each patient. Collected samples are then sent for laboratory processing. Once results are out, the nurse then calculates for the KT over V. Finally, results are then discussed with the physician. Overall, the whole process would yield to around 1,595 minutes non-value time and 318 minutes value time. Once performed, as the center caters to around 150 to 180 patients daily, it would cost around 1,500 to 1,800 reals per day for the expenditures. With the application of post-lean management, we were able to omit the collection of post and pre-urea samples. With that, we can directly connect the patient to hemodialysis machine and immediately set the KT over V or online clearance monitoring. This is how we set our KT over V in the machine. First, you click on the options or directly click OCM in the screen, and you will be prompted with the OCM menu or online clearance monitoring. We press on the value and calculate. For us to be able to calculate, we input the values weight in kilograms, height in meters, age, and lastly, the gender of the patient. Then you go back to the OCM menu and you will be able to see the details for estimated KT over V compared to your goal, which you can set between 1.2 to 1.4. After setting up the online clearance monitoring, the machine will provide you values for estimated KT over V that gives you the predicted value once the patient finishes at that present parameters set in the machine, determined like time, type of dialyzer and size, blood flow rate, and dialysate flow rate. Take note that this value should be more than 1.2 as set in our goal. Lastly, we have to record the actual KT over V in the nurse's notes and in the diary. And this can be referred to our doctors. For the value time, we will have 283 minutes and non-value time of 30 minutes and of no cost. In order to improve the dialysis adequacy equated in KT over V, massive actions were taken by the nurses in collaboration with the doctors. Some of these actions are proper selection of dialyzer as indicated to the patient's body size and condition, promotion of a complete time of dialysis session of patients, increased dialysate and blood flow rate, management of access issues, sufficient and safe dosing of anticoagulation, and lastly, intensive health education, particularly on the diet of the patients. This core management chart is also being posted in each halls in order to serve as a guideline for the staffs to follow. For the results of KT over V, we calculated the number of patients who had 1.2 and above. Before the lean management was implemented in the months of March and April, we had an average of only 31%, or 106 out of 344 patients had KT over V of 1.2. After implementing the lean management, we improved the number to 43, 45, and 46% at the last quarter of the year 2021. For the coming months, we want to target at least 60% of our patients to achieve KT over V of 1.2 and above.
Measuring KT over V, or quality of dialysis for end-stage renal disease, is one key of improving the dialysis for the end-stage renal disease patient. KT over V is one valid of improving the patient quality of life. Plus, it will enhance the staff for easy record and easy setup of quality of dialysis. It gives a chance for general nurses or nephrology nurses to interpret in the treatment. Plus, keeping staff updating on the patient quality of dialysis is very important aspect in improving the patient quality of life. KT over V, or quality of dialysis, is not only the one key of the things which staff are looking out. It covers many things like patient daily care, dialysis performance, as well as the investigation and administration of medication. It is good opportunity for this project to be invented in Renal Dialysis Center Bosher to give us very valuable measurement of quality of the dialysis during each dialysis for the patient, as well as maintaining patient quality of life, maintaining patient education, and improving service. Thank you for quality department team in Renal Dialysis Center Bosher to give us this opportunity to enhance the lean project as KT over V measurement.
KT over V serve as a numerical tool for me to determine the adequacy of dialysis of my patients. Because of the promised results, it's helped me to make an intervention and action to make or to improve the adequacy of dialysis throughout the HD.
KT over V is easy to set with few details to input in the machine itself. This is very simple step before connecting patients for dialysis, making a huge difference on how we make our decision for patient care and health education. Also, utilizing KT over V gives us an opportunity to make difference in patient's life.
السلام عليكم ورحمة الله وبركاته. معكم هاجر العامري. أنا بديت غسيل من 2017 وحاليا تقريبا حوالي 5 سنوات من بديت غسيل من خلال تفعيل خاصية كفاءة الغسيل الكي تي في في الماكينة. عرفت إنه ضروري أغسل 4 ساعات وبسرعة أكثر عن 300 لأن صارت صحتي أحسن وأفضل إن غسلت 4 ساعات وبسرعة فوق 300 لأن صارت نتيجة الكي تي في أكثر عن 1.3 وهذا نتيجة يعني لتصفية الدم أحسن وأفضل.
بسم الله الرحمن الرحيم. أنا إبراهيم ناصر زاهر الخروصي من مركز غسيل الكلى ببوشر. عمل غسيل من 2016. هذا بالنسبة للمشروع الكي تي بي صار أفادنا كثير في هذا الشيء، لأن كنا نرسل تقارير على أساس نعرف جودة الغسيل فنعرفها في اليوم الثاني. أصبح الحين نهاية كل غسلة نقدر نعرف جودة الغسيل وصلت 1.2 أو أقل، وإذا أقل نقدر نعرف إيش الأسباب اللي قلت في جودة الغسيل. والجهاز والبرنامج أفادنا كثير لأن زاد التواصل بيننا وبين الطاقم الطبي بالممرضات أو الدكاترة في هذا الشيء، ويقدر الواحد يتحسن جودة غسيله في كل مرة.
Hi everyone, my name is Ali Al-Mazroui and I'm on dialysis since 5 years now, and I am a father and a husband, and I used to work as a firefighter, and I lost my job because of this condition. Since I start dialysis, then I lost my job, and I want to say that most of us as a patient during starting on dialysis, we don't accept this as a patient to be on dialysis. Most of kidney failure, they don't accept that they are on kidney failure. But we carry on with the dialysis, and then we do accept that. And we praise Allah, Alhamdulillah, Rabbil Alameen, for that. And let's say that since I lost my job, luckily that I'm in center Boucher kidney dialysis center, which is there is doctor and sisters and brothers helping us in such as many ways in doing proper dialysis, which is helping us to get more healthier than we are, because as a kidney failure we can't get properly dialysis or properly blood clearness except if we go through this machine, which is dialysis machine. And since Boucher, they started new facility or new technique, which is mostly it used not to be there. When they start that, I find myself more healthier, and I found myself more, I get more clearness after the dialysis, and I can come to know that when I'm finished dialysis. Earlier, it used to be like every month I will go with the report to know how clearness my dialysis is. But nowadays, with that technique, with that feature which is there, I came to know immediately after the dialysis itself. I come to know that how clearness my dialysis is. In the future, it's here. It's called KTV, and let me show you the KTV. We go here, and we have to mention the weight and the height and the age and the gender. Then we set it on. Once we set it on, it will give us the clearness, and it will show. And between 1.2 to 1.4, it's the more clearness, and which is the target which supposed to reach. And with that one, every after session of dialysis, I found myself, since we start this, I found myself I'm totally fine. And even when I go out from here, I find that it's make me comfortable, and it's make me feel like better than earlier, how it used to be. So I think this facility or this future, it will help most of the patient if they know more about it. And with that one, you should know from the sister, from the doctor, to get more knowledge about this future. And I'm so happy that this Boucher Center, Boucher Dialysis Center, they brought this in, so it can give us or it's help us in many ways. It help us in knowing the result before after finishing the dialysis, no need to wait for end of the month to know the result from the doctor. And then from it, we can ask doctor if the result is not okay. We can ask doctor what to do to improve ourselves in getting more clearness. And to reach this target, there is many reasons that you have to follow that you can reach to the target which you're supposed to reach. For example, like the speed, how much speed it should be, and then there is many other. Those mostly they will come to know from the sisters and brother in the center, in Bosher Center. They can give more information. I'm so glad that this future is here, and I'm so thankful to this Bosher team that they brought this future, and I really wish them all the best and send them my best and thankful for all of them, starting from doctors to brothers and sisters, all of them. Thanks so much.